Hello, everyone. This is Joanne Tremblay, and thank you for joining our webinar today on new applications of AI for your practice. The integration of artificial intelligence into medical practices is transforming how physicians deliver care. I'd like to introduce our guest speaker for today's presentation, Dr. Ryan Badwani, to help walk us through some of the new and exciting developments in healthcare AI.
Thank you, Joanne. It is a pleasure to be with you all today. As practitioners, we all face several consistent challenges in patient education. Our clinic schedules are at capacity, limiting the time available for patient interaction. Yet, patients require thorough understanding of their procedures and treatment options. Research demonstrates that patients typically forget between 40 to 80% of medical information immediately following consultation. This retention gap creates both clinical and practical challenges that need to be addressed systematically. The traditional approach to patient education relies on three primary methods: printed materials, such as brochures and handouts, referrals to online health resources, and in-person consultation time. While these methods remain valuable, they present limitations in scalability and effectiveness. Each approach requires significant time investment from clinical staff while offering limited ability to track comprehension or engagement. Understanding these limitations is essential as we consider more advanced solutions. Multiple randomized controlled trials have demonstrated the efficacy of multimedia-based patient education. Video content, in particular, shows significant improvement in patient comprehension and satisfaction with informed consent processes. This evidence spans various surgical specialties and procedures, consistently demonstrating enhanced patient understanding compared to traditional methods. Contemporary AI solutions offer four key advantages in patient education: automated generation of condition-specific materials, interactive question and answer capabilities, personalized care guides tailored to individual patient needs, and multilingual support for diverse patient populations. These features enable practices to scale their educational efforts while maintaining consistency in quality and messaging. The AI physician likeness adds a personal touch that helps maintain the doctor-patient relationship even in digital interactions. Generative AI represents a significant advancement in artificial intelligence technology, capable of creating new content based on learned patterns and structures. In medical practice, this technology enables us to generate personalized educational content. These tools enhance patient understanding of complex medical concepts, treatment options, and expected outcomes. Implementation follows three key steps. First, creating a digital version of yourself that maintains your professional presence. Second, reviewing and approving AI-generated content to ensure accuracy and alignment with your practice standards. Finally, deploying this content through various channels, tablets and waiting rooms, text messaging, email, or QR codes, allowing patients to access information when and where they need it. The implementation of AI physician avatars yields 6 measurable clinical benefits. These include streamlined explanations that reduce repetitive clarifications, better prepared patients who arrive with informed questions, increased comprehension of medical concepts, continuous care support beyond office visits, improved patient satisfaction scores, and notably higher treatment adherence rates. These outcomes directly address many of the fundamental challenges in patient education and engagement.
Thank you, Dr. Badwani. That was extremely insightful. Now, I would like to introduce Matty Crescenzo, founder of Valet Health. He is going to walk us through some advanced AI workflows for patient engagement.
Thank you, Joanne, and it's a pleasure to be with you all today. AI-powered workflows bring together several key components. First, we use automated analysis of ICD-10 and CPT codes to identify patients. Then we select candidates based on data and proactively flag individuals using their medical history. Finally, we create personalized education pathways that reach them through highly engaging channels. Regarding engagement, text messaging has proven especially effective, with an impressive 98% open rate, and 90% of messages being read within just 3 minutes. Current patient engagement methods present several limitations. Manual chart reviews consume valuable staff time and risk oversight. Marketing efforts often lack systematic implementation. Tracking of patient education effectiveness remains minimal. Email communications show low engagement rates of 12 to 25%. Perhaps most significantly, many private practices lack proper CRM systems, missing opportunities for structured patient communication and engagement tracking. AI-powered patient engagement systems address these limitations through physician avatar videos, automated workflows that are responsive to patient interaction, comprehensive engagement metrics tracking, and AI-driven CRM solutions. The integration of text message communication significantly improves information delivery, with engagement rates far exceeding traditional methods. The integration of AI-powered CRM systems enables innovative healthcare solutions that extend beyond traditional patient education methods. This approach combines automated analysis of medical coding with proactive patient identification, creating opportunities for more targeted and effective patient care pathways. By leveraging AI-driven CRM automation and physician avatar videos, practices can deliver proactive, personalized patient care while guiding patients toward optimal treatment pathways. This systematic approach enhances both clinical outcomes and practice efficiency. The evolution of patient engagement represents a fundamental shift from reactive to proactive care delivery. Through AI-driven CRM automation, personalized physician avatar videos, and data-driven patient identification, we can provide enhanced treatment guidance while establishing a foundation for continuous engagement optimization.
Thank you for your attention, everyone. Now let's open the floor to any questions from the audience.
Hi, Maddie.
Hi, Joanne.
Love these lunch and learns from Plymouth Medical. There's a lot of good content there on AI, and everyone's talking about AI today, and certainly how it affects our lives on many different levels. But we thought to sort of shed some light on the uses of AI for our clients and their clinical practice. I don't know if it was obvious, but certainly the entire presentation that we just went through was entirely AI generated. So Dr. Badwani, our guest speaker, yourself, myself, all went through this 10-minute process where, we had sort of videographers come to our office, and in 10 minutes, I was able to read a script while I was being filmed. And from then on, I had basically access to 75 plus videos ranging from what is Neo Way all the way through to this presentation here. Maddie, tell me a little bit about sort of the evolution of this OnDoc and Autopilot Plus from your perspective.
Yes, well, I think that, I can't recall a more exciting time it's in the history of Valley Health where there's a technology like this that means so much for patient education, patient experience, but also creating efficiencies for practices, right? So, we really became enamored with the tech to be able to get some of this initial video footage captured and then have all these assets that's for video. That's always been a challenge for practices, right? How to be able to have video content that can enrich patient education, patient experience. One of the things that we had uncovered in working in our partnership with OnDoc is being able to have, though, a delivery mechanism and a delivery engine to get it in front of more patients. That's where the Autopilot piece of it comes in with the technology that we've developed, which is it's a CRM, a HIPAA compliant CRM that does text messaging campaigns, and there's a whole patient pipeline tied to it. It's really the marriage of those two, right? It's taking these unique video assets for conditions, for treatments, being able to have access to so many of those once the doc approves and approves the scripts and we have those videos, but it's getting it in front of more patients. And then also in a very targeted way, We could run specific types of text messaging campaigns for specific indications, utilizing the avatars as well, delivering it with the Autopilot solution. So
So, I mean, in my opinion, that's what's so exciting about, using and leveraging this tool, just because our clients keep telling us, look, I have so much time limited to educating my patients. I feel like I'm saying the same thing over and over again. I don't have any resources to film the, 80 plus videos on all the different, indications that I treat in clinic today. So from our perspective, we're really excited at Plymouth Medical to have developed these tools with Valley Health and OnDoc to sort of put our heads together and think about some initiatives that our clients can really leverage and re-engaging with existing patients and their EMR. So the code pulls that you mentioned, the sort of the NEOA ICD-10 code pulls for patients that have, previously been seen for viscosupplementation in the clinic for NEOA. Like, how do you re-engage with those patients to let them know, hey, I have high dose PRP now, and that could potentially provide you with, better pain relief over what was, what we've treated you in the past with. So just being able to re-engage with those patients is such a powerful tool, and being able to do so so seamlessly and without like a huge lift is even more palatable from our perspective. I think another use case that we should definitely mention in this context right now is, attracting new patients from a specific, geolocation. If for whatever reason you've purchased, like, let's say a shockwave device from Plymouth Medical, and you want to specifically target, all lateral epicondylitis patients in the Palm Springs, California area. This could be, this tool could be leveraged as well to sort of to reach out to those patients and let them know what you're able to do with the tools that you have. Can you talk to me a little bit about, the clinic workflow optimization that you kind of see, you foresee this tool being used for as well, Maddie?
sure. One of the things that I think is really key is creating an experience where there's less friction for the patient, so it's easier for them to get in touch with the practice to be able to get scheduled if they're interested in being a candidate for high dose PRP, for instance. But also from the practice side, right? Gathering more information up front for potential new patients or candidates. So the Autopilot system in that CRM, think about something as simple as, okay, patient Google's, right? They Google, okay, I have partial rotator cuff tear or shoulder pain, right? And they're looking for a doctor near them, right? Or it could be knee pain, whatever the condition might be. They come across a blog post, they come across a website page. There's a call to action to fill out a form to request an appointment. Well, by putting in a system like Autopilot and having a CRM, what that would do is as soon as they fill out that form, that patient gets a text message immediately. And that text message asks them, are you a new patient or are you an existing? And if they're new, there's a flow of new patient intake, very simple forms where the information is captured up front to help qualify the opportunity. So then it tees it up for the patient schedulers. They're notified immediately. They go right into the system, and then they know here's information about this potential a new patient, right? And so it gives them a qualified pipeline, and it helps from the patient perspective, right? Like we're beginning to forge that connection where then they're engaged with the practice via mobile. So from that very first touch point in their journey, when they come across the practice, right? When they're made aware, they come across the practice, they reach out for an appointment, they're beginning to have, a very positive modern, experience getting a text, right? And then us helping the clinic and helping staff, to be able to get that intake form information. The other thing we've seen be really effective is then, let's just say if here's a common scenario, somebody calls back to get the patient scheduled, right? They have their information from the form captured. They don't get a hold of them, right? They leave a voicemail. The great thing is they could also text message inside of Autopilot, the system. They can text the prospect.
Yeah.
Say, hey, we just left a voicemail. Is there a convenient time? When would you like to come in to be scheduled? And that's a way to help capture and not lose opportunities, right? But
Oh, for sure. I mean, I don't answer my phone during the day when I'm in meetings and whatnot, but text messages, I'm always reading throughout the day. So this kind of goes back to the point that we made during our AI generated lunch and learn webinar, that, you know, text messages are sort of responded to a lot more frequently. What's exciting from my perspective as well is that, you know, patients like to see their, you know, their doctors, they like to interact with their doctors. So one thing that we thought in the sort of patient journey, once a patient is scheduled for a PRP, if they were to get a sort of a reminder from their physician the night before to say, hey, don't forget to hydrate and don't forget to, you know, avoid these foods, et cetera, or
right.
take your supplements that were, you know, prescribed by the clinic, and don't forget your CBD. All these things will kind of help ultimately with the patient outcome, but also just kind of further strengthen, like you said, the patient's interaction with the clinic. So that's, I think, a very powerful tool. And, you know, patient education has always been sort of our focus at Plymouth Medical, because of the orthobiologic field is sort of expanding. A lot of new data is coming out. So we're really kind of looking forward to start outlining these new initiatives, like starting with high dose PRP for knee OA, because that's predominantly, you know, the sort of, I guess, the highest use case for PRP across the musculoskeletal providers. But, you know, shockwave therapy for lateral epicondylitis, you know, or plantar fasciitis, for example, or even PRP for, you know, tennis elbow, golfer's elbow. You know, the sky's the limit in that regard. So we're going to be sort of outlining these new initiatives on a quarterly basis throughout the year, starting with high dose PRP. So as far as some questions that have come through, one of the questions on this webinar basically it pertains to sort of who owns my digital likeness. Obviously, you're kind of recording yourself on AI. You have this avatar that's created. Like, I guess it's a certain level of, you know, concern about who retains control on that physical likeness. Can you talk about that a little bit, Maddie?
Yeah, great question. It's 100% owned by the physician, and nothing gets out there publicly without a login and approval of scripts from on the back end, in order for these videos to be utilized on the front end for public facing purposes, website, text campaigns, links from social media. So the great thing is, you know, after the filming, like we were saying you're mentioning at the top, you
Yep.
just the initial filming, less than 10 minutes. Once you're good with, a doc will review his or her avatar, be like, cool, that looks good. Then they have a login right after that they can go in and see scripts. So if they want to talk about, like sometimes we've seen this with, for example, if there's a specific condition and they approach it differently from a diagnostic process,
Yep.
they can go in and modify those scripts, then click approve. And then that goes into the training data to the AI model to then give the output, right? That's where our part with Valley Health and the Autopilot engine comes in, is once we get that approved video from the physician, or they could go in if they're cool with all the scripts, like by default that have been developed. Like the easiest way is they go in, they click approve all, and then they have all 70 plus videos. The point is the physician's in control of his or her likeness. Nothing ever is going to get out there that's rogue with an avatar, because the only way to be able to get a code to embed it means the doctor has to log in to be able to, you know, potentially edit the scripts, but to approve them. So we really like
What
the
you're
fact
saying is
that,
I don't necessarily want to be giving my back end password to my children,
right,
so they can play around with my avatar and have me say
right, right,
things. But
right.
ultimately, I retain control on my physical likeness. I get to decide what I say and when I say it. And I guess
Sure.
the real reason why I actually wanted to go through the experience myself is, like everything that we launch at Plymouth Medical, we want to be sure that it's, you know, vetted, tested. And, you know, as you can see, my physical likeness sounds and talks like, she looks like me, she sounds like me, and now I can basically quickly communicate, you know, all of this to, you know, our clients, and just the sort of the sky's the limit from that perspective. There's another quick question that came through. What if there's like of the 75 plus videos that currently exist, what if, someone has their own ideas, or they do a procedure that's like kind of a not standard? Are there ways for new videos to be proposed?
Absolutely. We would love to have that feedback. I think any of those potential new, whether treatment videos or condition videos, but especially with advanced therapies, in terms of the clinical toolkit, right? We want that feedback. That feedback can be shared amongst, directly to Plymouth, to Valley Health directly, or to the OnDoc team. There's various ways you can get in contact with us about that. But we want to collaborate with the physicians directly and understand, hey, like, docs that want autonomy and doing what's best for their patients with the treatment solutions that they pick, right? That they think are best for the patients. If there's not a video that's there, or a series of educational videos that could really bring value, then we want to work together to create the new scripts, to capture some of the footage, to create that educational content about that new therapy, so that we can make the patient experience more dynamic. Like you said earlier, Joanne, I think when a patient not only hears the physician voice, but sees their doc explaining a procedure and go, oh, wow, like I didn't know that this was available, and I don't have to get a surgery or take pills or medication for it, and this new therapy is available. Yeah, tell me more. That's, but utilizing it to where they see those videos, they think it's really impactful. But we welcome all feedback, especially also anything we can do to level up. But getting more content into the library is absolutely a priority, and we would love to have that feedback. It's only going to make the experience better for patients, and it's only going to help more physicians and clinics across the country as we roll this out.
Perfect. Well, we're definitely launching this sort of collaboration with Valley Health and OnDoc and Plymouth Medical at IOF this year. So really excited about that. I do have on my screen a way for IOF attendees to book their avatar filming, and even after the IOF is done, booking the avatar filming obviously is the sort of the first step towards creating your likeness and your AI generated avatar. If there is any need for one-on-one conversations off the back of this webinar as well, we do have a QR code on the screen where sort of registrants can engage with us and have more in-depth conversations about what Autopilot Plus can offer their practice, from a lead generation point of view, from a reconnection with patients within the clinic, within a workflow optimization point of view, and even just like for general patient education, content creation. So without further ado, I'm going to adjourn the call today because there's no other questions that come through from the attendees of this Lunch and Learn webinar. I want to thank Dr. Ryan Bedwani for his avatar likeness. I also want to thank Maddie Crescenzo from Valley Health today. And again, please don't hesitate to reach out to us for any supports or questions off the back of this webinar or any others that we have. Thank you so much, everyone.